Another theme from the story work with First Nations, Inuit, and Métis people explores the complexities of travel to distant cancer centers, with and without families and companions, and how that affects them and their cancer journey. The doctors' and nurses' responses in the brokered dialogues reveal an understanding of the problems of distance, of isolation from families, and the need for companions. The Dialogue and Story Work project used the brokered dialogue methodology. This approach unleashed the power of sharing stories to help facilitate safe, meaningful, and respectful conversations between healthcare professionals and Indigenous communities. Cancer survivors, those still on their cancer journey, and caregivers came forward with the support of community champions to share their personal stories and talk about the challenges and barriers they experienced when transitioning through different levels of care. Healthcare professionals then watched the narratives and responded on video, giving their professional opinions and thoughts on the issues and concerns shared. The healthcare professionals' video responses were then brought back to participants to continue the dialogue. Participants had an opportunity to respond on video to the healthcare professionals, in turn closing the loop on the dialogue in a way that was supportive and meaningful to each participant.
So I went back home, but I was really sick though. And then I went back to the hospital after a week. They told me you're late to get your blood, but the weather is always bad in the north. So I went back home, and the doctor, there was a long story. And I went back to the hospital. And this time they put me back in a hospital where I'm going to get my marrow back.
Particularly for Vicky, one of the big things was just isolation. I mean, these individuals are isolated geographically, but then it seems when they have a medical problem, we isolate them more when we take them out of the community.
And then about the end of July, I went down to Edmonton for my surgery. I was nervous to go in for surgery, like when you go into a bigger hospital in the south, it's scary. And I just had my trust and faith in the Lord. And
it's always difficult for patients and for doctors and nurses when somebody's diagnosed with cancer, first of all. Obviously it's life-changing. It's a life-changing diagnosis, and there is such a lot of work for the patient related to a cancer diagnosis. The fact that you have to go for many more tests, investigations, and eventually treatments, and you're coming perhaps from a small community where you have mostly nurses to look after you and not even regular physicians in the community.
I had to stay in a hotel for the first 2 months. And you don't have cooking facilities. And my wife had the darndest time trying to find me the correct food to eat. She was out running around every day trying to get me the proper food. And finally, in my 3rd month down there, I was fortunate enough to get an apartment. Kitson Health got me an apartment, and I was very fortunate. It was straight across from the emergency of the hospital there, so it was just a 4-minute walk to my chemo every day. But at that time, we were able to go out and buy the food we wanted and prepare it the way we wanted. And I think we need more of that. There's not much you can do when you have to stay in a hotel room and you don't have access to any stoves or any place to cook. And I don't like all this traveling. I mean, in order to go see the doctor, you have to have a CT scan 9 o'clock or so. So I have to leave here 6:30, 7 o'clock in the morning and drive to Terrace, winter or summer. Last winter was wicked. It was driving through snowdrifts. This year is not too bad.
It's pretty clear in that I mean, there's lots of challenges to going through cancer and cancer treatments, but particularly when you're coming from a northern or remote community, there's a whole other level of challenges that you have to go through where, some of the basic medical supports that we take for granted in bigger cities or towns are just not there. You have to go to a nursing station with a nurse that has a limited amount of medications even to help with pain and issues like that. So I think that is something that's hard for us to appreciate, that level of complexity and that level of additional support that's needed for individuals who come from more remote communities, whether it's in the north or elsewhere. There's challenges that we just often don't appreciate.
I remember one place when the doctor said, "Who came with her?" And they said the nurse from Inuvik. And then the nurse from Inuvik, they said, where's the relative supposed to escort her? We left her in Inuvik. That was crazy. My daughter came with me and the nurse took over, so they left her in Inuvik. He said, "I want her daughter to come in today," he said. Oh, he was mad.
I was at home and he came and I just started crying. It just broke my heart. And then for 3 days I just sat in my room and I just cried and cried. I was thinking, what's gonna happen with my son? How he's gonna make it through each day without me or his dad. And then the 4th day I got up and I thought, I'm not gonna deal with this. After I healed, I had to go down to the cross cancer. When my husband passed away, I always felt I needed to go to the cross cancer to give me peace, so not knowing I'm gonna go to the cross cancer for myself as a patient. But when I went there, I could just feel that peace come right through me when I went into cross cancer. And I was doing my checkups and I was treated good down there.
My parents never left my side, which also led to my own dad's business being let down because he never wanted to leave my side. We had no help from anywhere besides GHS, which helped us out very little, just enough to cover me and one other person to live there. And I was there for over 2 years, moving from place to place because we had no help. What little help came from our community was grateful. I appreciated it a lot. I had to live there as an outpatient because I had to get blood every day, platelets every day, and fluids, and still receiving chemo as an outpatient. After all my chemos I've already gone through. This is going on to 2 years now we were there. My dad, just so he could stay down there, he'd take odd jobs, doing whatever he could to stay with me. My mom took me to the hospital every day. And the doctor said that Robin, who was my match, by the way, my bone marrow match was my sister, because she was my match. She had to stay there, right there beside me, because if anything happened to me, if I flatlined or anything, it was her blood that was gonna save me, because I couldn't accept any more blood transfusions unless it was from her.
A lot of people in our communities go through a lot of financial hardship. And how can we support a patient that's going through a terminal disease if we cannot support them throughout? At that time, the largest city was basically Fort McMurray. When, if you don't have any family members there, you have to find accommodation, travel expenses, how long you're going to stay. If you don't have the money, the only thing you can do is return back to the community, and you're leaving the patient behind.
People go away from work to support their loved ones, they lose income, and the impact is significant. So we try to mitigate that impact by constantly being aware of where do people come from.
When I was out in some of the communities talking to, going to some of the health centers, I know that there were concerns especially with elders that had to come to the city that only spoke Cree. I'm not Cree, so I don't speak Cree, but we have interpreters available, and I would like to think that, again, that they have the family with them, hopefully, that can help to translate.
Yeah, if they don't, people don't know, like if they're elderly, we should always have somebody escorting them that can, speak the language. She doesn't know very much, she can't speak very much English. That's why I had to travel with her. Yeah, we speak Dana. There's no translator, yeah. It would be nice if they have translator in the hospital. She could speak Cree too, eh? That way, if they have Cree or Dana language, she could have known better, right?
That time only cancer starting in north, I guess. And I know escort nothing. They just sent me just like that. And then when I was in Edmonton, they operate me. Oh, I went through tough, boy.
I argued with that doctor. I told him I need to go home to my son, and he wouldn't let me, and I just said I was going to go home. I need to go to my son. I needed my son at that time and my family because I went over there alone.
It would be nice if they would take, like, family members, if medical, travel, or anybody can just, like, make them comfortable in Edmonton, bring them there, pay for their flight there, and they can, like, stay there beside them while they do their chemo. I think that would be a lot easier for the patient. Yeah, because they're only allowed one escort, right? And it would have been nice if I would have been able to go to Edmonton. They would pay for me and my son to go there, and be there for my mom.
The people were talking a lot about the way they experienced their journey with cancer, and much of what they said would be things that I have seen firsthand with patients going through similar journeys. Things such as the problem having an escort go with them, and that I know is a different issue altogether, but as most of us know, cancer is usually very serious, and it's very difficult to deal with it on your own. You always really could do with somebody to share the journey with you, and I talk from personal experience here because my own sister had cancer, and she would say things to me that I know she misheard or misremembered because her mind was so full of different things, of pills and potions and chemotherapy, and it's very difficult to remember everything that you're told.
Generally, just on the escort side of it, I guess, just hearing how some elders travel without an escort where it's really needed, because the lack of going into bigger centers, and even me at my age, going into, say, Edmonton is something new for me. So, and emotionally, and you always need someone to assist you. So I think escorts is the biggest problem right now. To always have somebody with you, especially our elders. Mm-hmm.
So, and I think the other thing we can learn from that is that we really should help provide escort, a loving person to be with you, just as you say if you're in labor or going through any difficult experience. People fare better in terms of how quickly they recover and how much pain they experience if they have some loving support with them. And perhaps we can advocate as physicians for that to be more common.
To give you an example of the type of measures we take to mitigate socioeconomic issues, financial issues, travel, as well as distance, is we always endeavour to try and collectively investigate patients. What I mean by that is if a patient has certain tests to be done, we always try to do, and we go to great lengths, it takes a lot of time, to get different departments to do tests on the same day, for instance, because we know there's going to be travel involved. And there's a lot of resources spent on that kind of endeavour. As we've heard from one of the people in the video, the impact on the family is significant.
It can be difficult for the specialists in Edmonton to understand our environment up here. And I've had one example of an elderly patient who has a lot of difficulty traveling, and they were requesting her to travel down to Edmonton essentially for a conversation, something that could have happened on telehealth. So that was a bad experience for that patient, and then we had to, here's our healthcare team, we had to intervene and come up with a different solution to what was being suggested from Edmonton. So I think part of it is just what's being asked of patients here to do in terms of accessing care in Edmonton when the travel is not necessarily the right way to go.
In general, if you were in a small community like a Klavik, one of the nurses would explain what's going to happen to you and give you all your paperwork. Like the travel would be arranged through something we have here called our special clinics, which does a fabulous job of coordinating all of this, the travel, the place to stay, the ride to and from the airport, to and from your appointments. And it's all delineated what appointments you'll have. And then usually either in the community, a nurse, or here, your physician, if possible, but sometimes the nurse in the clinic will sit down with you and go over, okay, Tuesday at 10, you're going to have this test. At 2 o'clock, you'll see the specialist. The next day, you know, and try to explain to people that's the ideal. And how they're going to get picked up and what to do if anything falls through the cracks, who to phone. And they get paperwork with the numbers on, that sort of thing. Mostly it works. Once in a while it doesn't.
What we have heard is from the story work with First Nations, Inuit, and Métis people, and the brokered dialogue with the healthcare workers in communities and cancer centres. They talked about the problems of distance, family, and companions. From the story work, which issue stood out for you? Which issue stood out for you from the responses?